Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. It's a pleasure to be back with you again tonight. I'm your host, Dr. Bernard Fialkoff. And first, we'll take care of a little detail. Many of you have been wondering, how do I become a member? How do I subscribe? It's very simple. Go on YouTube, click A Time for Truth show. Hit the subscribe button. We'd love to have you as a member. You'll be availed of the past 6 years of episodes and segments. There's no charge to you. And all that we ask is you take the information and you make a better world, a happier world. And that's what is the purpose of A Time for Truth show. So tonight, in that vein, I'm going to actually share with you part 2 of a series that we started regarding how to preserve your confidence, your smile, how not to lose your beautiful teeth that make that great smile of yours, that give you that comfort when you're with people, when you're speaking, that gives you the ability to enjoy your favorite meals, the oral cavity, the gateway really to the rest of the body, because nowadays we realize that infection and inflammation in the mouth actually goes throughout your body. Firstly, into the lungs and into the gastrointestinal system. We always make a joke. There is no customs agent preventing the inflammation from traveling through your body, through the bloodstream, through the lymphatic system, through the inflammatory system, throughout the body. So it's very important that we prevent any disease, any inflammation in the oral cavity, and also preserve your teeth, which really do so much for you. And it's that saying that you don't really know what you've lost. You don't really know what you have until you don't have it anymore. So let's go to the first image, please, engineer. And we'll start with our show, which is part 2 of restoring your mouth with implants. And there, on the first image, you see one of the patients that we treated many years ago now. I've been in practice for 42 years. In the metro New York area as a periodontal and dental implant surgeon in Queens, New York. And she was about 18-year-old young woman, had congenitally, which means from birth, didn't have her lateral incisor. So she had braces. The orthodontist positioned her teeth correctly, and we placed an implant. And then her general dentist, which happens to be her aunt, actually fabricated her tooth for her. And there you see the image. Came out gorgeous. When you look at it, you can't see anything. It's actually a lateral incisor, and she was ecstatic. Let's go to the next image. But how about in these cases? What are you supposed to do now? What are they going to do now? You know, look at the upper left and you go, my Lord. The teeth look like they're going to walk out of the person's mouth. They're covered with tartar. They're so really ugly looking, far beyond what anybody would want in their mouth. You can almost imagine the feelings of this person when they're with people, when they smile, when they speak, because, you know, they're obviously something that these other people are going to be seeing. And the self, confidence is gone, and they're just not going to be comfortable. If you look at the bottom left, you see sensitivity from receded roots, and that person's not going to be comfortable eating. Smiling, they're going to show gaps, the black triangles between the teeth, very unsightly, very non-cosmetic, the result. And on the lower right, you see the bone loss, the inflammation, and what we were, really insinuating and starting to introduce you to is that inflammation is the cause and the basis of all diseases, including cancer. So inflammation in the mouth is not something innocuous. It's not just you need a cleaning. What you're doing is actually preventing inflammation in your body, and you're subsequently, or in an associated way, getting your teeth cleaned. But we're doing much more than that in the dental field, and it's not the cleaning that we thought we were just doing a few years ago. Let's go to the next image. So what happens if you had the unfortunate history where you've lost teeth, where economically you weren't able to replace them? And so you had these plastic temporary, which are not so temporary sometimes because the person doesn't move forward, but you have these plastic appliances made for you. These appliances grab the teeth, sometimes with wires, sometimes with rubberized type of plastic, which snaps in and grabs your other teeth. So obviously, if it's doing this pressures that it exert, they end up causing recession. The gums go high on the teeth. As they do that, the roots become exposed. Decay can begin. When the decay doesn't begin, sensitivity ensues. And then the decay begins because a person can't clean their teeth because they're too sensitive. They can't function properly. They're uncomfortable. And really, the person usually ends up wanting to remove these plastic denture cases that they have, their teeth. And the problem is, by the time they do, they've affected the adjacent teeth, because these denture teeth grab onto the teeth and they exert pressure. When the person bites, the pressure goes through the appliance into the teeth. And so really it's a vicious cycle, with a person thinking that they're solving something by filling the space with these plastic, what's called flippers sometimes, temporary dentures, and they end up losing more teeth. Let's go to the next image, please, engineer. So what happens when you come to our office? So the first thing that we do is we greet you, find out what is it that you're looking for, because we treat people, we don't treat teeth. And what your goal is very important, because we work to achieve your goal. Not everyone who comes in wants to have implants. And in some cases, they refuse implants, and we do other treatments. We actually work with you to give you the alternatives, the pros, the cons, so you can decide what is the path that you want to take. We help you get your maximum insurance coverages, because dentistry is definitely expensive. And so whatever we can get your insurance to help you with, we definitely do. We provide financing, which is 0%, great company that we have. And so we find out what you want, We do an exam. We take scan x-rays of three-dimensional imaging quality. We take intraoral digital x-rays, which are really state-of-the-art because in today's dental world, the radiation is very low because everything is computerized. And so the amount that we used to use many years ago is no longer necessary. And because it's digital, the information, that it's really amazing what we acquire and what we can work with to plan where to place the teeth. Let's go to the next image, please, engineer. Now, this is a case that's very interesting because on the upper left, you'll notice that on the x-rays, it looks like the bone, which is the white in the middle of the black, the bone looks much thicker on the lower right than it does on the upper left. And you say, well, how is that possible? Well, that's because the person came in on the upper left and wanted implants, but didn't have adequate bone. So what we did is we actually grafted the bone, and you see there a term says membrane bone grafting. What happens is the membrane is like a mesh, and that mesh protects the bone powder graft that we place to regrow your bone. And there you can see in 5 to 6 months on the lower right how much thicker the bone looks. Why is this important? Because that's where now the implant is going to be able to be placed. In the previous, on the upper left, when they came in, there wasn't enough bone. And what happens, in many cases, there are dentists who take weekend courses or very preliminary courses, but start placing implants. And if you don't have the ability and the competence to graft the bone, to increase the bone width, those implants will eventually fail. Many times they fail very early because the bone is very narrow. And then many times the dentist also places a smaller implant, which is not as strong, and it can't really resist the pressures of the bite, and it compounds the felony, and the person ends up, after spending all this money, and then they lose their implant tooth. Unfortunately, in my office, as time is going on, I see that happening more and more because unfortunately there are many dentists who take weekend courses, sometimes for a few months, and that really doesn't compare to the experience of being a surgeon for decades of lifetime. So that's the result that we can get with membrane-guided bone grafting, and you see it's a tremendous result, and it makes your success much higher into the future. Let's go to the next image, please. Now, let's take a look at this one. And on the upper left, you'll see there's an implant, but you see there's no bone around it. And what's happened is this person developed an infection, lost all the bone around the implant, was referred to me. She was an older woman, very distraught. She thought she was going to be too old to heal. I said, no, we'll be able to do something for you. And so what we did is on the x-ray to the right, you'll see we took out the infected implant. We irrigated the area. We debrided and cleaned the area. And then on the upper right, you see now you have more density in the area. Why? Because we've placed a bone graft. And you see the bone graft that we placed in the area to fill in the defect with a membrane like you saw in the previous slide that I showed you. And then what happens is about 5 months later, because this is an extensive bone loss, and you have to give the bone a chance to heal. So 5 months later, we go to the bottom left, and you see where we place the new implant. And you look and you compare the top left to the bottom left and to the bottom right, and you'll see the tremendous result that was achieved, where we remove the failing implant, we put the bone graft, and then when you get to the bottom, you see how we placed the new implant in her mouth. We let the implant heal for about 4 months or so, and then you see the new implant crown. You see how it's healthy, the bone is filled in, and she lived the rest of her lifetime with her tooth, we were able to rescue her. We're so happy to be able to help her. And this is an example of result. Let's go to the next image, please. So here's another one, another woman who came in. On the top, you see how much bone loss there were around her teeth. She thought she was going to have a denture. So I explained to her, well, it looks like we can utilize some of these teeth that you have, and we can make you a temporary bridge. So you don't have to have plastic coming in and out of your mouth at nighttime or when you eat. And she understood the benefit, and so we referred her to a dentist, and that dentist made this woman a temporary bridge that was cemented in place. And you see that in the middle pictures now, the hopeless teeth are gone. You see the bone graft was placed, and you see that the teeth that were kept were prepared, and a bridge was made temporarily so that you could heal. And the bone heals much better when it's protected, like you see there in that x-ray. At that point, we placed the implants, which you see on the bottom. That's the same woman. And the implants were utilized to do implant bridges. And you see how we transformed her case from the tremendous amount of bone loss that you saw, removing the infected teeth. And remember, infection in the mouth and inflammation is going to travel throughout our body. So by removing the infected teeth, we're removing what's called granulation tissue, which is the infected soft tissues around these teeth. She was healthier. Normally the people say, I feel lighter, or I feel more energy. And it's not their imagination. What's happening is we're getting the inflammation out of their mouths. And when we get the infection, inflammation out of their mouths, their bodies heal, they have less disease, and they're actually more energetic. It's not in their mind, it's an actuality of what happens systemically or whole body-wise as we help you to clear up the infection. Let's go to the next diagram. Now, here's a CAT scan rendition of another case that we did. And you can see on one side how the bone is very narrow. And then you can see on the right side how the bone becomes wider. Now, how did that happen to be? Well, like in the previous, what we did, we cleaned out the infection, we put bone powder, and then by using a membrane, again, which is like a mesh, we do membrane bone regeneration. And when that bone heals and now has that new width, what that allows us to do is to put some nice, strong implants, not very tiny, thin implants, because there are many courses given out there with using these little, very 2mm implants. And the courses are promoted because those practitioners are not really adept and are not going to be healing your bone. So you have to realize that there's a reason why there's a need for training in order to be able to heal where those implants are going to go, which is your healthy bone. You want to have your normal width of bone so that way it can support your bite, your smile, and you'll be comfortable. So let's go to the next image, please. So, once we graft the bone, and the bone is strong enough, now we can place implants like you see here on the screen. Because by doing the bone grafting, that makes the implant placement more ideal. Why is it more ideal? Number one, you could use wider implants. The wider implant will be a much stronger implant and help you to maintain that bite at the right pressure level, at the right dimensional level, so the person doesn't develop TMJ because if the bite is not correct. The person will develop temporomandibular joint syndrome. Let's go to the next picture. And what happens is now, once we do that, the person has their teeth again. And they go, wow. And they forget when they didn't have teeth. There's usually some pink acrylic around the teeth because we have to fill in where the bone has been lost, but it's not seen because the lip lines cover it. And you can see here an example of that very case with what I was showing you. Let's go to the next image, please. Excellent. This man came in, his name was Victor, and Victor wanted an implant on the upper right. He didn't want to cut down his molar and his premolar. He didn't want to shave them down to make a bridge. Years ago, we used to make bridges. We'd shave teeth down. That was irreversible. Many ended up needing root canal. Some of them fractured. Some of them developed periodontal disease. But by placing the implant, as you see there in the middle, we're able to give him a tooth that you see on the bottom right that he's had now for about 15 years. But how do we get from the upper left to the middle diagram? As you see, there's like a halo of white, and that's a bone graft. That's actually a conservative, what's called a sinus graft, where we actually graft bone into the sinus below the membrane, and you see it form that concavity around the implant. And then you see on the lower right, now about 7 years later, how that bone actually integrated, became part of her bone, and held her implant for the future. Let's go to the next image. Okay, now, let's take another patient. This being, a man in his middle age, and what he came in with. But before we do that, I want to actually show you a little video that we're going to play for you on the sinus grafting. Because the sinus grafting is something that can really save you and creates tremendous opportunity where years ago you couldn't have it. So let's look at this short video, please. Let's go ahead, engineer, put the video on. Next slide. Here's another example, because you're probably out there say, well, but I lost all my tooth, Dr. Fialkoff, and my doctor told me my sinuses are too large. Well, it's no longer true, because in dentistry, we have an ability to grow bone, and the bone can be grown in areas of deficient bone anatomy. And there you see it, the upper right, the person had very severe gum disease, lost their teeth. On the next slide to the right. And there you see on the bottom how we grew the bone back with a sinus graft, how we put the 3 implants, and how the dentist then made a bridge on those implants. And he's been functioning this way now for over 20 years. Next slide. Another case, another person missing their upper teeth, was told that the sinuses were too large, they could not have implants, came to me for another opinion. We did sinus grafting the same day as we put the implants, the same technique as you saw before. And there you see how we domed up the bone and had the bone receptor site that the implants would go into. And there you see on the lower right, the result now 4 or 5 years later. You can see how the bone has matured, and you can see how she has those 2 implants. She's very, very happy and has been having a great experience. When she comes back to see us, she's always happy. Very good. So here we go with a man. You see on the upper left, he had very advanced gum disease and tooth decay. He was wearing a denture that you see there on the right side. And what we did is we took out the teeth on the top. We put in implants that you see on the bottom x-rays. Let's go to the next image, please, engineer. And here you see the final result that I treated with his general dentist, Gary. The implants that we placed, the bridge that Gary placed, and the smile that he had. He constantly smiling. He was so happy. He just couldn't get over it. So let's go to the next image, please. And let's look at this. This again is more sinus grafting. That's a special machine when we need to do more advanced sinus grafting. It's called the piezoelectric. It's a special instrument that vibrates and it's very safe. And you can see on the top x-rays how the top right, the person has a missing area of bone in the sinus on the upper right. And then if you go to the right picture on the top, you'll see that now there's like a bump of bone. And that bump of bone also on the bottom picture is there. What that is, that's a bone graft that we placed where that person now can get an implant where before there was just a hole in the sinus. Let's go to the next image. And here's another one, a case where we start, you see there's no bone. On the top left, we put bone, more bone, and then the implant the same day on the bottom left, and then we let it heal. And then you see 7 years later, not only the implant there, but the crown is there, the bone is healed, beautiful result. Let's go on to the next image, please. And here's with braces. We align the teeth, we put in the implants. Let's go to the next picture. And so case comes in with occluded teeth, out of position, with spacing. We do the braces. We get everything aligned. We put in the implants. And then if you go to the next image, please. There's the result. Voila. And if I didn't tell you, we'd never know. She was so happy. She has 2 implants. And on the next show, you have to figure it out because I'm not going to tell you where they are. But she has 2 of them. And her dentist, John, did a great job. Let's go to the next image. Here's a woman who was losing the implants that she had on the top. There was bone loss. She thought it was hopeless. We put new implants that you see below, totally in bone, grafted. Next picture, please. And they healed. You see her new bridge with full bone around the implants, with the teeth. She was ecstatic. Let's go to the next image, please. And let's go to the next one, please. And it's just important to realize so much can be done. We can take you from gum disease, treating the gum disease, healing the bone, putting in your implants, and getting those beautiful white teeth that you wanted to have back, that you thought you were doomed to dentures and clicking and popping and moving and shifting. It's not necessary anymore. Our patients are so happy in our office when we give them implant teeth and they restore their confidence. Let's go to the next slide, please. And, just showing you some cases we've done. Let's get the up close and personal. Go to the next image. She was ecstatic. Let's go to another one. Here's another one. These are the incisors that I told you were the braces. This is a young girl who also was missing teeth and we replaced. Let's go to the next image. And, it's important that we get this out. So I educate, get out into the community. I educate my colleagues and also have a website that you can go to and a Facebook page, Bernard Fialkoff DDS on Facebook. Let's go to the next image. And if you need any help, feel free to call us. You can check our website out online, Bernard Fialkoff DDS. You can email us at bernardfialkoffdds@gmail.com. Or you can call us at 718-229-3838. In any case, you can enjoy your life, get back your confidence, enjoy your food, smile again. I hope you've enjoyed this segment, and we'll see you on the next episode of A Time for Truth show. Be well.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet